It all started almost 50 years ago when, in private practice, I started to attract people that were sent to me from the next town over, then the next city over, then the next state over, and then different countries for a variety of conditions that were not typically associated with good outcomes. So I had a responsibility to learn more and talk to different people at different institutions about further graduate study, and did a PhD degree and learned about how to understand the brain, and mainly from an educational perspective of mind, body, brain. Had some great advisors, learned a lot very specifically to develop my dissertation on the neurophysiological implications in learning. I realized that patients had to learn to walk again, that many of them had to learn to speak again, they had to learn how to use their arms again, they had to learn how to deal with disabilities that were terrible for them and their families. So I needed to learn how the brain would process these things, and learn how to better measure the things that I was doing, learn how to analyze the statistical expressions of the measurements that I was getting empirically. And that started at the same time that I was directed by a fellow Dr. Joseph Jancy to have the responsibility to share what I was doing with other physicians. And I said, okay. And I was thrust into a teaching role and developed a curriculum of neurology with applications of physical rehabilitation, which was different than that was offered, for instance, in physical therapy or in occupational therapy or in chiropractic. So that little blend of things that I did was what I was asked to teach, and I taught that, or developed the course to teach them, with a blanket of understanding based upon what was currently known. And this is before the internet, so I had to go to the university library in the middle of the night and search through stacks and grab papers and Xerox papers and really work to learn how to do things better and to understand the brain. The word simply spread about how to increase human function. And then at that time, the sports world sort of caught hold of what I was doing, and I was sent people that had suffered sports concussions and really were out of their sport. They couldn't play it anymore. And for whatever reason, they started sending them to me, and the outcomes have been well discussed, I think, on television and ESPN and by the players and their teammates and coaches, so that people were back in the game. But not only back in the game, but their function had increased. So they were better than they were before they injured their brains. And again, the term functional neurology came about, and I think that might have been coined by one of the producers from the public broadcasting system that did, again, specials on my work with vegetative state patients, as well as patients that had dizziness chronically and couldn't walk, and some really dramatic cases. And when that film came out, that documentary, that gave more attention and more responsibility onto me. The sports performance part of my practice literally exploded, because when you send people that have injured their brains back to their sport, whether it be hockey or football or baseball or boxing, and they're better than they were before, other people that haven't had brain injuries wondered if they could get better or if they could have their neurological function improved. And I would answer them very eloquently by saying, I don't know, maybe, but this is what I can do. Everything that I do is based upon a neurological examination, so that if you don't see in one quadrant of space, then I can do things I know that might make you see better, but we can measure it. Or I would get an Olympic swimmer that wasn't doing well, and I would find out that as she was swimming, just the lines in the bottom of the pool would make her eyes move and develop what we call nystagmus and slow her motor her motor power, if you would, down. And I know how to do very well with that through other patients, was able to make some changes in function, and they can win, medals at the Olympics. So that success, patient success, really traveled in advance of any randomized controlled trials, which weren't existed. So the evidence base was largely based upon patient perceptions of how they were, of the perceptions of other people that managed, sportsmen, athletes, people in industry. I was sent so many patients from industry that had injured themselves on the job, but also people that were frustrated in their job and developed a variety of different types of medical problems based upon frustration or boredom. And I was able to change those things around. What was the evidence for that? Well, the evidence was in the patient population and what I was seeing and what I was documenting. And so the evidence, we call it a tripartite stool, where we have literature on one side, patient outcomes, and the doctor's experience. We had two of those legs rather firmly, and I wanted to learn how we could build the third leg. And as a consequence, my education continued after the PhD, other courses of training at very good institutions in Boston and abroad, to learn statistical methodology, to learn more about how to train doctors, developing in another master's degree in that field, so that I could share the things that I had learned. But all at the same time, I have always been in the trenches as a practicing clinician to this day, although it's changed a little bit where I've evolved into doing things virtually. And it's really majestic when you look at the function of humankind, even at a distance. We have the skills now and the technology to be able to see someone in another country. I used to travel across the seas to the Orient and examine patients, and then fly to Paris and examine. I don't have to do that now because I can see them face to face on a computer screen, and I can have another neurologist or someone who's trained to tap a tendon for me so I can see if the leg bounces or not. I get to see them walk, I get to see them talk, and then I can give them different therapies to see if we can make a change. And if I don't make a change, I have enough experience that I've got other tools that I can put in and not give up on the individual patient. So that is, I think, in a nutshell, just the progression of what we call functional neurology. It's become very, very popular, and so popular that everyone does it. We have trained probably the majority, over 90% of people that do functional neurology. But now we've got different things like functional neurology or functional neurology part 2. And the consequences to humankind, I think, have been dramatic. Most institutions will incorporate work that we've pioneered and give us credit for it, which is always nice and polite and humbling. So that's it. Increase human function using the neurological system as a window to measure and quantify objective things that will guide different treatments to hopefully improve people's lives. The question of a eureka moment of when I suddenly realized that I was onto something, that's a big one, because I've had them every day with every patient I see. Every patient is a eureka moment to me because I treat them specially and I treat them individually. I don't cookie cutter my treatment. So what is really big for someone may be trivial for somebody else, but someone may want to be able to get off their chair and walk to the bathroom. And if I could do that for them, it's a miracle. And to me, that's a eureka moment. Whereas somebody else wants to win a gold medal at the Olympics and they weren't doing well, and I gave them some strategies that were able to allow them to do it. That's another eureka moment. I look at every patient that I've been honored to see as a very special opportunity to serve very special people. So the things that I learned in the treatment of one patient that just wanted to go up to the bathroom translates very, very well into an Olympic sprinter. And you'll say, how? Because it's one system. It's a nervous system uniquely different and individual that tells me that my treatment must be unique and individual. And I'm excited when patients get excited, whatever their goals are. It's a very interesting question to ask about the impact of my life and my practice on the general community, or the community at large, specifically the general medical community, medical practitioners, or ancillary health practitioners. It's been marvelous. That's all I can tell you. I've been embraced from day one, and people would refer patients to me just literally by the truckload. And I'll tell you how it happened. People would have a patient, and that patient was a frustrating patient that, for whatever reason, happened to end up with me. And I would send a report back, and the patient would go back and talk to their doctor. And they would call me up and say, man, that's really exciting. What did you do? And we would have a conversation that sounded reasonable. And then I get a phone call and say, well, could you see this person for me? And that's how it happened. It happened locally, and then it got bigger, and then it extended states, and then to the present day it's extended countries. And I have referrals and talk to people on the phone that are thousands of miles away, from the Middle East to Australia, New Zealand, Korea, India, and Canada, all throughout the United States. So I have never had any problem with my community. I didn't have a competitive spirit. I was accepted as a specialist really from day one, and responded by reporting what I saw and what I found. And people developed a respect or an admiration for my truthfulness, my honesty, and I think my abilities. So it's been just a very rewarding time. In my life, in my work, that's the personal and professional, I reflect daily on everything that I do, and the positive and the negative. And when you're involved in a pioneering therapy or the development of a new discipline, it sometimes it's like being caught awestruck at the magnificence of the human nervous system and how people can restore function that was presumably lost. And when you realize that you have been a part of that, or a part of the change in someone's life, it's very humbling. And you need to reflect so that you're grounded and that you don't get carried away and really believe the things they're saying about you, realizing that you are the servant and you realize that you want to do it even better the next time. So when you have a marvelous outcome, I've always reflected and say, what did I do wrong? Even though it was a good outcome, I always wanted to do it better. And I think that reflection has allowed me to do it better. And I do things differently today than I did yesterday, and hopefully I'll continue with that. I'm not satisfied with marvelous miracles. I want the miracles just to occur all of the time. And I was asked on an interview, I think it was ABC, about, how do you deal with these miracles? That's what they call them. And I can tell you honestly that when things happen every day, they sort of are not miracles anymore. The first one is, the second one is, and then they become expectations. And I think that's what functional neurology gives you, an expectation of an outcome that was heretofore thought to be miraculous is something that I expect and that my patient population expects, and other people that have been trained in functional neurology also expect and experience. Our student body of learners and scholars are people that dedicate themselves to lifelong learning. The things that we do are difficult. No one is ever going to master all of it. It demands a continuous reflection of where one has been and where one might be able to go. As a consequence of this, if we looked at a cross-section of what an average scholar would be, I would say that we attract healthcare practitioners that want to make a difference in their life by dedicating themselves to formidable study and application that is impressive. And they lead, they inspire us to do more, and they inspire others. And through this leadership and dedication to the service of humankind, they establish a reputation as lifelong learners that are contributing. Our scholars publish papers in very good journals. Our master's degree graduates publish amazing papers and research. We have got a reputation among the world of scholars to look at the work product that we do with respect, with admiration, with accolades, and also with comments and directions so that we can do it better. You know, when we have people that want to learn with us, it's an honor, and we don't get caught up in it. We look at people that are very talented, we add them to our faculty. We have a large number of people that want to teach with Carrick Institute, and we're really proud that we can choose the best of the best for this. We get them from around the world. Personally, I have academic positions at different medical schools in the United States and in Europe, and I'm involved in different training of physicians at different levels, and then with the Carrick Institute into specialty types of education. I'm so happy and pleased to realize that the faculty that we have at Carrick Institute are talented, that when I'm long gone, they are going to continue on with a viable model of service to others. This Carrick Institute phenomenology is long-lasting. It is not a one-man show, or started out as a one-man show, is thousands of people that are joined in a common zeal for learning and for helping people. Board certification in health disciplines is important to the public and to all professions. To the public that search out their doctors based upon their qualifications and ability to understand at a very high level what they have, is absolutely important with choice. To other healthcare professionals who need to refer to a specialist, they want to refer to somebody who has a proven, accredited demonstration of their capabilities of practice. They need to entrust that person with the responsibility of doing the things that are necessary to a high level. And board certification is independent of any educational process. So board certification is not an anointment by the educational institution that trained the doctor. It's by an independent agency of scholars and academic people that can credential an individual based upon many different criteria. We're very fortunate that in functional neurology, we have both national and international recognition of the board certification credentials. This is absolutely important to have a bona fide credential that would give the public the confidence to trust people to do things that they say that they can do. Board certification is still relatively new, less than probably 100 years, where board certification was a voluntary thing occurring years ago in the early 1900s by ophthalmologists that realized that people that were treating disorders of the eye should be trained at a higher level than a general physician. And as a consequence, they encourage people in this discipline to step up their game, take examinations, hold themselves out to peer review, and deliver a different product. Well, it caught on, and as a consequence of voluntary participation, it really has become a required modality that you're not really going to be practicing a specialty discipline if you're not a specialist. In the discipline of functional neurology, there is a possibility to have practitioners that might signify that they practice functional neurology or neurology that are not board certified. This is not in the public interest, and it's not in the interest of other professions. Board certification is tough, it's rigorous, it's independent, but it's something that will protect the public and offer the greatest probability of a better outcome because of the rigors of entrustable activities that are measured in board certification. Board certification gives credibility to a discipline. Along with that credibility comes an increased or heightened responsibility. Board certification is not something that is granted once, it's something that must be maintained. And in order to maintain the certification, individual certificants must recertify every year in the discipline of functional neurology. This is tough. It's real. This demonstration of continued competency that is necessary to maintain one's board certification really tells the public that the standards of a doctor who is board certified in 1982, for instance, is as good as a new certificate. You can't get old in the board certified register. The credibility of having independent recognition of your board certification is absolutely huge. It gives one a badge that demonstrates that the practitioner or the board certified member of the diplomate register has obtained and maintained a specialized level of education and competency that is rigorous, that is in demand, that is respected, and is valuable. We oftentimes look and reflect on people that do become board certified. You can practice in some areas without having board certification, but if you want to do the right thing for people, then you need to entertain the higher educational demands and time and sacrifice to get there. Board certification allows people to really become all they want to be. If they love something, a specific area, then they can learn more about it through appropriate fellowship programs, board certification programs, residencies, training experiences, and so much more. So when we look at any individual that decides to enter a training program or residency program, which takes several years and in fact a lifetime in functional neurology with the continued demonstration of competency, we admire them. I admire them. They are marvelous, and I just love seeing them. I love talking to them. I love hearing how smart they are, how intelligent they are, and how concerned they are about giving the highest quality of service to humankind. When it comes to functional neurology, it is largely, but not limited to, a drug-free application, because a good number of neurological conditions that are seen in the average population are not amenable to a variety of drugs. People don't like to treat pain with opioid analgesia anymore. People are worried about addiction. So as a consequence of the development of different strategies that are drug-free and surgery-free, there is a big demand by the public and by practitioners to develop training programs very specific to those needs. As a consequence, the field of functional neurology continues to grow and grow. And every year we have more people in training than we did the year before. It's really amazing, and I think I don't even know how big things are going to be. Certainly, neurology is a difficult area. It's not for everybody, but for those people that have the abilities to master information, to understand it, it's a very rewarding field. And because of the attention that we've received, many people early on in their careers gravitate towards training in functional neurology, and the numbers just continue to explode. Functional neurology treatments are often the first choice of many patients, especially in the athletic world. It's very popular. It's already happened. And it's very interesting that athletes, competitive athletes, can't dope. And what constituents of doping are very difficult, because you can take a cough syrup that's got something in it that's going to trigger an expulsion from a sport or a sanction from a sport. So athletes love functional neurologists. They love a drug-free regimen of care that is offered. So for certain groups of people, functional neurology is the first stop with neurological disorders such as concussion or aberrancies in gait or other types of performance activities. Other patients come to functional neurologists, usually as they come to other specialists, when things don't go as well with one type of treatment as they should. But what we're finding is that they're usually sent over by other treating providers of different disciplines. It's not uncommon to have referrals from a dermatologist, from plastic surgeons, from general surgeons, family physicians, of course. So depending upon the area, the knowledge of the practitioners, and the demand of the patients, people might see the functional neurologist as the first choice, or they might be 4 or 5 down the line, depending upon what they get at other providers. If people have successful treatments, they're usually satisfied wherever they go. But there's a big window, I think, of opportunity for people that desire, for many different reasons, a drug-free approach to treatment and rehabilitation. And literally, everyone knows that you should walk every day, that you should move every day. And there's nobody that understands that better than the functional neurologists that utilize those types of tools in human motion in a different way than anyone else has ever used them. So much so that people wonder, like, what is this that they're doing? And the outcomes are like, wow, wow. So I think that public demand and different referral sources will place the opportunity to see the functional neurologist at a very high level, and oftentimes, because of needs, the first level of interaction among many different options. I'm very excited about the future of our discipline for many reasons. One, Younger people are exposed to so much more than I was ever exposed to. Internet has changed things, artificial intelligence has changed things, learning models have changed things. We educate people, we teach them better than we've done before. We can instruct people on ways to obtain information that were not even possible or dreamable before. So we're going to have people that are better focused and skilled to do the jobs that I do right now. They're going to be, we don't like to use the word smarter or more intelligent, but it sort of bottles down to the fact that people have more information, will probably be able to utilize it better than I can, or people of my generation. I'm a digital immigrant. I wasn't born with a phone or a joystick. I've come into this and I've embraced it, and I've learned a lot about learning models and how to use artificial intelligence ethically in patient care and in medicine. But I'm a digital immigrant and I still have to translate that, whereas my grandkids, they can do things as even when they were like 6 or something that are more masterful than my abilities to understand it. So I think we're in really good hands for the future. And the way technology is advancing, I just see great benefits for humankind coming down. And I think the artificial intelligence is not going to replace anybody, but I do believe that people that understand how to utilize artificial intelligence will displace the ones that don't know how to use it. So I think we're pretty firm, and we're lucky for future generations that they should have better care than we have. I'm oftentimes asked by students or individuals that are looking at a future life course, a career choice, of whether or not they should study functional neurology, for instance, as a career versus being a firefighter or a policeman or a surgeon or a lawyer. There's so many choices for people to make. And I can tell you without equivocation that a life as a functional neurologist is unbelievably rewarding. And I can also tell you quite clearly that people that practice functional neurology are genuinely very happy. I can say more happy than sometimes other disciplines. The work hours are great. The on-call is less. The responsibility is high, but the gratification makes the work so worthwhile. Some disciplines are very difficult just on the mind. If you look at some of my colleagues that are oncologists that deal with death and dying in their patient population every day, functional neurologists largely don't do that. They look at increasing function of the living, and largely a younger population. It is less stressful and is involved with phenomenal rewards. The brain and nervous system are so exciting. Everybody wants to know about their brain. I've never met one person, whatever the basis of their education, who wasn't interested in what happens in the brain. You say the word and the eyes pop out. It's just amazing. It's been a source of discussion since the beginning of time. And if you like to be challenged, if you like to be looking at an insurmountable mountain that you've got the map to do it, then functional neurology is a good home. Having had the experience that I've had in almost 50 years of practice and as a medical educator, I find that people that I've trained that now have sons and grandsons or daughters and granddaughters are seeing people follow in their footsteps. So I have people that I train that are 3rd and 4th generation now. Something marvelous has has been happening here, and these people excite me. I think they're very lucky to have stumbled in, however it happened, into this discipline, and I'm sure glad that they did.